You're on.
Good morning. On behalf of the Greeley Area Chamber of Commerce, we want to welcome you to this edition of Common Grounds, where a lot can happen over coffee. My name is Jamie Henning, and I'm proud to serve as the Greeley Area Chamber of Commerce president, representing over 700 businesses in the Greeley area. We know this is a very challenging time for our business community, and we want to do the best to help them pivot and keep their businesses moving ahead. We'll be hosting these live on Zoom every other week at 7:30 on Tuesdays, and you will not want to miss them. Today, I am really proud to be joined by some tremendous community leaders, and it's my honor to help create a platform where we can keep you updated on the Chamber of Commerce. We can keep you updated on stories and updates about the city we all love, and get to know our leaders a little better this morning. We're grateful at the Chamber to lock arms with our leaders who genuinely care about this business community, and we're joined by several of those today. We have been meeting as a team, a business response task force team during COVID, but we meet with our elected leaders on a regular basis. So it allows us a tremendous opportunity to interact, our business leadership and our elected officials to bring solutions for our community. We wanted to bring that forum to you too, so you can stay in touch on the latest developments and we can help broaden our audience and bring you information when you need it most. So our agenda this morning, we have about 5 minutes to give an update from each of the speakers you're going to hear from. We are honored because they are some of the busiest people in all of Greeley right now and doing a tremendous job to serve our community. My special guests today include our mayor, John Gates. Hello, John. Thanks for being with us again.
Thank you.
Our City Council Chair and Mayor Pro Tem, Dale Hall. Dale, thanks again for being on here. I think this is your third time on, so thank you. President and CEO of Ames Community College, Dr. Leah Bornstein. Leah, welcome. Thanks for being also serving on our board. UCHealth Greeley Hospital President, Marilyn Schock. Marilyn.
Morning.
We have both of our hospital administrators here. And finally, CEO of Northern Colorado Banner Health, Margo Karsten. Margo. Thanks so much for being here. Welcome to everyone. We're thrilled to have you. First up this morning is going to be our mayor, first elected in 2017 and winning in a landslide. He's the 49th mayor for the city of Greeley. He's also an integral partner in our recent Greeley Area Recovery Fund. So thank you so much for your work and collaboration with the Chamber Mayor. We want to have our mayor start things off this morning. We're thrilled to have you and thrilled to be able to rely on you, especially now. So with that, I'm going to turn it over to John.
Good morning. Thank you, Jamie. It's good to be with you all this morning. For those watching, thank you. And what an esteemed group of panelists I'm going to be joining this morning. So COVID-19 continues to be a wild ride for us, just like it does for all of you. Perhaps it's getting just a tad bit better, as I was commenting to our city manager, Mr. Otto, yesterday. Of course, our primary concern in Greeley is to get through this, have the numbers go down, keep folks out of the hospital. There are some positive trends that we're seeing in that regard, but the downer for all municipalities, I frequently talk to other mayors, and we spend a little bit of time complaining about what this has done to our budgets. No surprise. We've had a pretty in-depth analysis of our city budget by our financial personnel, and as a result of the pandemic, what we saw stings, and we knew that it would. As you probably know, we're reliant on sales tax and lodging tax to balance our budget. Sales tax held its own, our last report, but it's fair to note that your sales tax receipts are always a month behind. So we caught the tail end of the period where our economy was still really booming in Greeley. So we're pretty sure what the next couple, 3 months will bear, but we feel like we'll get through that pretty well. We have a really nice rainy day fund that at some point we'll need to tap into. Also reliant on lodging tax, as the chamber could tell you, that has come to a screeching halt. We're anxious to get that lodging tax back up, but you know, some of our bigger events like the Stampede, of course, the granddaddy of them all, and the Blues Jam and a one really big dog show have already canceled. So while I think they did the right thing with regard to the health and safety of those attending and our residents, those will be impactful to not only the city budget, but a lot of the budgets. So we've got a lot of work ahead of us. We're aware of that. Kudos to our staff down at the city who's working on this every single day. And we'll think we'll get through this really well. I'm anxious to get things open up in a, you know, a council opted to take a slow phased approach. The very last thing that we want to do in opening too soon is to overload our hospitals. Good to have Marilyn and Margo with us today. When we look at the numbers every day, the numbers are going up. We expect that with more testing, but one of the things that we're really looking at is the impact on our hospitals. And we see some really positive trends there from my perspective, so that's a good sign. We have furloughed 85 employees with the city, full-time employees. We had previously furloughed about 275 seasonals for venues that probably won't be open this summer, but we hope to have them back, and all things considered, we're doing pretty well, and we're going to get through this. Again, good to be with you all this morning.
Thank you so much for that update. We really appreciate it. Yeah, so many of those so many of those events are really interwoven into the hearts of everyone in Greeley. But I think taking a cautious approach, and we'll hear a little more about that this morning, is really the way. We don't want to see our economy backslide. We want to move into this in the right way. So we'll help our businesses through that. So yeah, thank you so much for that update. Our second guest is Councilman Dale Hall. Dale serves on the Chamber's Board of Directors and is a long-term leader for Greeley, Mayor Pro Tem for Ward 4. Thank you so much for joining us this morning, Dale. And if you can give us an update, that'd be great.
Well, thank you, Jamie. As the mayor has said, he usually tries to say everything I'm going to say. So we're trying to say something different, but most of it is pretty much the same thing. We have in the city now been working over the last 2 weeks on specific ideas on how we're going to open up the actual city offices for business. And it's not business as usual, but it will be business as we can make it work. So we're working on a plan for that. We get daily updates by email. And then we get twice weekly, we get trends for what's happening within the actual COVID issues. And I'm pleased to say that, like the mayor said, we are seeing some trends that are going downward finally. I like to see the trends from the hospitals, and I'll let them talk about those. But the trends are going in the right direction there. Actually, even the case growth rate is coming down statewide. We just got an update from the governor's office this morning that talked about how growth rate is continuing to drop from that direction. So we are not taking the stance of the authority for every business outside of the city government. We are allowing the state and Weld County Health Department orders to be in effect for those. But we are still very diligently working on how we do business as a city to the people that need to do business with government in the city of Greeley. So hopefully we'll be back up and running here shortly and see how we can make this thing work for everyone.
Yeah, wonderful. Thank you for that update. Also want to thank you for your diligent work on the Greeley Area Recovery Fund. To date, I think we've awarded over 59 businesses and raised a lot of money to help those businesses in the gap. So thank you, and Councilman Payton and Ben and Roy and the mayor. We've been working with all of you, and we're so grateful. We're hearing back from our businesses a really positive response on that help. So thank you again for that. Our third guest today is President and CEO of Ames Community College, Dr. Leah Bornstein. She's on our board of directors. This is her first time on the show. Welcome, Leah. She has dedicated more than 30 years to leadership and management in higher education and has led the college through the development and implementation of a strategic plan with some really exciting developments happening that even COVID can't keep us away from in terms of development in our community. So Ames is such a gem in our community, and we're excited to have you here to talk about that, Leah. Some really positive news this morning. So I'll pitch it over to you.
Great, thank you. Well, I'll start with our COVID update, since that seems to be the trend, and then pepper in some projects that we're moving forward and continuing the momentum, as you mentioned, through our strategic plan, which maintains or continues the excitement for us for sure. So with regard to COVID, actually, the college went remote, and what that means is we basically we gave ourselves an executive order, if you will, back on March 14th. So right before spring break, when we were noticing what was going on, we decided, since it was also spring break, it gave us a perfect opportunity to just utilize that time and go remote. So we actually went remote early, which really helped our own numbers and projections, if you will. So from March 14th through last Friday, totally with regard to what we know, we had 4 employees test positive. All 4 are recovering well. So our numbers remained very low, knock on wood, and continue to do so. As has already been suggested, we have crafted a 5-phase plan, phase 0 to 4. And we've been working on phase 0, which is really prepping the facilities and operations on all of our campuses to for whenever it is that we re-engage. When what that means is basically walking through every single classroom, every single office, making sure tables, chairs, etc. are distanced 6 feet or more. Floor clings, we've set up check-in stations where we have now a protocol for folks who are going to come to campus, some of those very essential workers that we actually started yesterday. So that's phase 1. So I'm going to bounce a little bit all over the place, and I'll get back to the protocols in a second. But our summer semester starts May 26th, and in anticipation of that, knowing that most of our folks can have access and can register, et cetera, online, that we also recognize that we have a bunch of folks who do not have access to internet or a computer, or cannot have their challenges resolved in a remote environment. So phase 1 was enacted yesterday, where we have limited number of folks for limited hours on a couple of days. So on Mondays from 8:30 to 12:30, and on Thursdays from 1:30 to 5:30, we have just a couple folks on all of our campuses available to help new and current students with whatever they might need. So again, moving back to phase 0, to prep for that, again, the social distancing with our physical environment, but also check-in stations. So we are requiring everyone who comes to any campus to wear a mask, whether that's an employee, a student, a vendor, excuse me, anyone. So they must check in, show their ID or some form of identification, wearing a mask. We are taking temperatures, and we're giving folks a wristband with a date, so that they can then go ahead and move around the cabin, if you will, go from building to building. And every day that they come in, they need to do that process. So for example, today I need to go in and switch out my monitor because my monitor died. Even though I could very easily run into my office and switch it out, I will be going through the check-in station, getting a wristband, going to my office, switching it out, and leaving campus. So the majority of us remain working from home, if you will, in a remote environment, but we have already engaged several folks. So now next week, I believe, after we know that this is rolling and moving forward, we're going to then really fully discuss what phase 2 and 3 look like. So we're staying a little bit ahead of what is happening, but wanting to make sure that we don't get too far ahead and jump the gun. So we're maintaining all forms of communication, obviously nationally, globally, locally, throughout the state, et cetera. Some of the fun stuff, not saying that's not fun, but what's keeping a smile on our face. We had commencement last week, which, you know, mixed, bittersweet. You know, some folks like, oh, you know, it's very sad that we couldn't be in person. However, I will say we did a video. It wasn't live, it was recorded, but I wasn't sure how it was going to come out, and it actually came out fabulous. And watching the chats, there were so many more folks that were able to participate for our graduates all over the globe, and were able to participate in chat, and it was really exciting. And there's some techno magic out there for media communication. So it really looked like we were there in person, and moving through the ceremony as it would have been. So it was really outstanding. And we were fortunate enough to have Mayor Gates with us in a groundbreaking for the Welcome Center and the Student Commons over at the Greeley campus. And we did that last week, I believe. The days are running together a little bit. We did do that outside in groundbreaking because we removed some dirt. We made sure the piles of dirt were more than 6 feet apart. We had masks on. We were outside in the wind. It was not a public event, so it wasn't large group, but we did record it, and that will be going up on our website this week. So we certainly were able to celebrate that not only for today's enjoyment, but for posterity as well. So I could keep going, but I'll stop there. Lots of great things happening in the midst of all this sort of craziness as well. So thank you for having me, Jamie.
Yeah, thanks for being on, and thanks for showing the way in leadership. Technology is definitely helping us find a way, and in some ways broadening our audiences, right? So an interesting time for sure. Our fourth guest today is Marilyn Schock, president of UCHealth Greeley Hospital. Marilyn has been involved in healthcare for also 30 years, so we have some tremendous leadership runway on this call this morning. From her work as an occupational therapist to being a hospital administrator, she led UCHealth through the opening of a $200 million 50-bed state-of-the-art health campus, and also the new UCHealth Greeley Hospital in July of 2019 opened. So we're proud to have her serving on our Greeley Area Chamber Board, and in snooping around a little bit online about her, she's been described as a talented, proven leader who never loses sight of what matters most. I loved that. So thanks for joining us, Marilyn. I'm going to go ahead and pitch it to you, and we look forward to hearing how you and your team are tackling this really big mountain right now. So we appreciate you.
Great. Good morning.
Morning.
Thanks for having me this morning. It is a good morning. I will tell you, per even what Mayor John Gates said, is we are seeing lower numbers of our COVID patients in the hospital, and that's good news, especially as sick as people have been. So Greeley Hospital has now been open for 312 days, and I keep thinking I'm going to switch that from days, but it's been less than a year, and who would have thought we would have the opportunity to open a new hospital and deal with a pandemic in the same year. And, just opening a new hospital was significant, but I think the team has done some amazing work in regards to the pandemic and really dealing and working with the community. All about partnerships. We have partnered in the community, and I'll talk a little bit about that with our emergency management, with Banner, with other healthcare organizations, with our assisted living to long-term care. And that's really been the key of getting through this. Over the last 9 weeks since this really started happening, it was kind of one of those signs. We had people coming in and asking for masks, and we knew, we were all kind of watching the news and watching what was happening of this new virus that was hitting the United States. And we were having people coming in droves through the doors asking for masks. And I was like, where did this come from? Well, Target was out. Everybody was out of masks. And it was posted on social media that we had masks. And so people were coming in and just taking masks. And that was really the start. And I laugh now because I was thinking, wow, there was so much more going on with the anxiety and that whole feeling of what's coming at that point. And over the last 9 weeks, we have had our incident command structure set up, both at a facility level as well as our regional level within UCHealth, working with Banner's incident command, working with the city, the county, and the state, as well as our system. And I will tell you that the command centers have done a lot of great work together in partnering and making sure that the communication has been there. It was a growing pain of who needs to have what information, because we haven't been this widespread of the need for something this long. And so I said, in the world of healthcare, it takes a lot to do things. And something that was taking us 4 months to do is now taking us 4 hours. We are just rapidly making changes upon what's happening today. And that doesn't happen in business. And I will tell you, in healthcare, it really doesn't happen. But we are doing that, and we have made some pretty amazing changes. When when it first started, we had very busy emergency departments. Those have started to trickle off. We actually have taken that step back, and people stop seeking care at the emergency departments other than your respiratory patients. I think, with all of the surveys going on, I think everybody's kind of said, what was that? Why didn't people come to the emergency department? There was so much more in-field treatment and people staying home. And then when people were coming to the hospital, they were really sick. We have been working on our bed capacity. I've never seen so many ventilators in one unit in my entire career, where it just kept coming and we were having to double up patients in rooms. We were in contact of where's the best place for this person to go? Where do we have a bed? Where do we have ventilator? What do we need to have to care correctly and appropriately for the patient? And I think the confidence level should be very high in the community of what the healthcare systems were able to do in making sure that people could get the right care. The communication has been phenomenal. It was nothing to have almost daily calls with Margo or at least text where are we with some of these pieces. And the teams were doing that as well. It was across the board. I think when we were really seeing the height of the surge, PPE is really a key piece in regards to, and will be ongoing. I don't think we can let off the pedal of what PPE is and making sure that we continue to use it appropriately, or the personal protective equipment, masks, gloves, our gowns. That will be something. I'm proud of UCHealth. We have had, our supply chain team has done a phenomenal job making sure we were set with that. Our team's all hunkered down. We had people on the front line who didn't want to take the virus home or the potential of that. They stayed in hotels. We had folks staying in some trailers, their camping trailers, of being able to make sure that when they were on shift, they weren't going home, and that they could make sure that they were keeping people well. I'm happy to say we had very few cases internally as well with staff. We did set up a hotline so that we would check anybody with any symptoms as well, and we would act on that accordingly immediately. So again, the responses were, I never thought I'd ever see anything like this in my career, were phenomenal in regards to how everybody was responding and making sure that our folks were taken care of. The community really rallied for us with the hospitals, all the appreciations. I will tell you, that's what kept the staff going. The food, the parades, the planes, it was cool. It gets me kind of welled up. Excuse me. Clinics have transitioned to virtual visits. We are about 80% of our internal med physicians are doing virtual visits right now. Now, some of that will change. They need to see and lay eyes on the patient directly, and some of the care that really needs to take that next level. But again, virtual care works, and you will see that continuing to work. I think for all of healthcare, and what we need to do to take care of patients, both on that remotely level, that convenience level, but then also of having the clinics available to take care. We're resuming surgeries and procedures and imaging tests, and we're doing that smartly. I think one of the big pieces that I would continue to encourage everybody is take it slow. We still don't know what's out there with the virus and what's happening. We have partnered, and thank you, Leah, and your team, partnering with us to set up a community testing site. Yesterday, I know we saw close to 200 over there. It is continuing to pick up. I think it is critical to get folks, do you have it, are you quarantining, and particularly as people continue to get out and amongst people, of how we need to make sure that people are staying safe. And so I think it's a slow and go. Again, it comes back to a lot of the partnerships. And then I think, it's really, I'm proud of where we are with UCHealth. It's made my job a little bit easier in regards to our supply chain, making sure we can keep people safe. This community and the partnering and everything that we've been able to do together, this has not been an island for anybody. And if you've tried to function as an island, you're probably not there. Because it really was a time for all of us to rally and come together. And you know, I think Greeley at large just wrapped their arms around what we needed to do from a healthcare perspective. I think, you know, to the mayor's comments about the community, this is a healthcare crisis that has created an economic crisis. And we have to make sure that we keep healthcare in the forefront, and that's working with our public health, working with what needs to happen to drive us forward in how do we open safely, and making sure that we keep people safe, not just the overwhelming of the hospital, but people are very, when we saw people sick, I've never seen people so sick so fast. You know, they would be talking, walking, doing fine, and 2 hours later, we were putting them on a ventilator. Those are the pieces that you don't see when you're out in the community. I was asked yesterday as well, is this really real? And I said, wow, today I can breathe. But 2 weeks ago, walking into our ICU, it was a whole different story. And I think those are the pieces, is let's not lose what we've learned and keep moving forward, knowing that this thing is not going to go away till we have a vaccine, and being able to prevent some of this. So again, I thank everybody for all of the support, and you know, we're going to continue to beat this.
Thanks so much, Marilyn. Truly, the collaboration here was one of the first things that spoke to me in meeting with you and our other hospital partners. We're so grateful for that, and that's incredibly important at a time like this. So thank you. You and your teams are heroes right now, and the praise and accolades can't come enough. So thank you. Someone asked me yesterday, who are you looking to make decisions? And all of us on a leadership level are working through that. I said, really, our healthcare providers, right? They're leading the way, and they're telling us what we need, and they're telling us what they're seeing. So we'll keep working with you closely. So thank you for that.
Great, thank you.
Our next guest is Chief Executive Officer of Northern Colorado Banner Health, Margo Karsten. She provides overall leadership for Banner in Greeley, Loveland, Fort Collins, and other area hospitals. She also oversees 11 acute and critical access hospitals in 6 states. With over 30 years, again, in executive roles, she has elevated organizational and clinical excellence, achieved quality and service awards, and is innovative, creative, and engaging with her teams. I have had the honor of working with her personally, as I do Marilyn. They both serve on our board of directors, and Margo is also the incoming chair of our Greeley area chamber. So we're so thrilled to have you this morning, Margo, and we look forward to hearing a little more from you on how you're tackling this moment. So I'll turn it over to you.
Thanks, Jamie. I'd echo a lot, Marilyn, what you said early on. I think we had our first patient like March 12th. I called Kevin Unger and said, here's the deal. Let's keep people safe and work together versus compete. And that really has been a blessing. And as I look to Mayor Gates, I just can't thank you enough for support. As Marilyn said, the parades, the fire engines, we had staff on the Sky Bridge and in the ICU windows just looking out. So meaningful. And this community has just rallied. I just will do a shout out, Dr. B. If every business could phase in like you are, no worries on our end. That's the thoughtfulness that I really have appreciated in the city of Greeley. So again, early on, I was studying, I have a friend in Evergreen, Washington, and just kind of reached out and said, what are some early learnings? They got hurt first hard. And she said, it's all about partnership. And so how lucky are we in this community for the partnership that we have? So echoing everything that Marilyn has said is what I'd say from a Banner perspective. The good news is our volumes are down. I just looked, we have less than 30 inpatients, which is crazy awesome. Our ventilator use is significantly down. To Marilyn's point, Easter weekend is where I saw us peak, and that looked like 2 patients in 1 ICU room with 2 vents, and very serious, like Marilyn said. I think what's confusing is it has hit all generations, and yet not all of us have gotten it. And so when we look at our employee base, we're doing serology testing, and over 1,000 employees tested, and less than 2% are showing antibodies, which means we don't have what people are calling herd immunity. So the good news is the PPE worked, and the challenge is we're not immune. And so as we look to the fall, I think some ideas that I think both UCH and Banner could do with the community health departments is how do we get in front of this? What does that look like in flu season? And if COVID's coming back, which people say it is, how can we arm everybody in a very health oriented way, getting their flu shots? Hopefully we would see a vaccine soon. If not, how do we get people healthy so we can fight this virus versus we're never going to avoid it. So I always share with people, how do we become life with COVID, and what might that look like? And how can we save as many lives as possible? And how can we avoid admissions together? And I do think as larger employers come online, lean in. I'd say, Leah, you have some best practices that you've shared. As schools evaluate in the fall, what does that look like? I don't want to speak for Maryland, but I feel like we're like this now. Lean into the healthcare systems. How can we help you? We've been doing employee screening for 9 weeks. We probably both have tweaked it enough to say, oh, this is what you should do. Ooh, don't do that. But anything we can do to help the economy get healthy, we're all in. It's to our advantage if we can help people get their businesses up and going in a thoughtful, safe way. It's going to benefit all of us. So I think we're at phase right now is let's help together. Let's find best practices to keep our businesses economically healthy and their employees healthy. And we're going to be successful together. So again, just grateful, you guys, for the partnership. Everybody reached out early. Leah dropped gifts off. I mean, it's just, I'm with Marilyn. You get very emotional thinking about, I'm old, like 1984 nurse, and I have never seen such partnership and true, authentic, how can we help you? We're in it together. And we get to see 3 cities, and I'll tell you what, you all have been amazing in Greeley. So just a big thanks from Banner.
Thank you to you and your team, truly, Margo. What you've all been tackling is so important. I'm actually going to go a tiny bit off script for my first question, and we'll talk a little bit about the new normal. I think that's important. We're all being asked that question, but one of the things that stuck with me, I asked our healthcare providers. It was pre-COVID or right at the very beginning to speak to our chamber board of directors, and one of the things that stuck with me, they both said, is one of the trickiest parts of working in healthcare is really understanding end of life care, right? And working on that with families. And if that's challenging before COVID, that's got to be especially challenging during COVID. And so my question to you is, how are your teams managing that? Because that's really hard to start with and is incredibly different when, there's isolation or things like that you have to tackle. And I'm sure, again, you've pivoted beautifully in that as much as you can because there's no choice, right? So I want to just pitch that to both of you because that always stuck with me from your presentation that day.
Yeah, Jimmy, I think that's been the hardest. So as a nurse, I'm a nurse. First, limiting visitation is counter to anything we've ever learned in our profession. And so that was super hard to go to 0 early on. And we knew it was right because we knew if we brought visitors in, they could be contagious and not know, as well as the PPE use. So that was a first really hard decision. And then to limit the number of visitors for our birthing moms as well as our end of life. I think those were some of the hardest early on decisions that I was part of in Banner Health, because literally we were debating, do you even let someone in at end of life? And I think the team would say I'm a little Norma Ray-ish in that when there's a passionate issue, I'm going to fight, and I don't care about my job because I don't think it's about us. It's about who we serve. And so I would say any clinician, physician, and nurse would say to this day, that's been the hardest, is allowing limited visitors in to say goodbye, and thank heavens for technology. So I know many of our physicians and nurses would hold phones up to their ears, allow the goodbyes. Like this, Marilyn, is where I get very emotional. A lot of Skyping to say goodbye. Again, kind of bittersweet. You want to be in person and there's extended family. So I think we certainly have learned to do this differently, like Dr. B, you said on graduation. I do think end of life is going to look different for the rest of our lives. Visiting is going to look different. And thank heavens for technology. I know we had physicians literally meet families out in cars and talk with them. And so just the compassion is what we can't capture. And so if you see us get worried as people get started up, it's all about our team and all about what we saw. And we want to be protective and supportive at the same time. But I would say end of life was the hardest thing for our teams to deal with.
Yeah.
And I would echo that as well. I was talking to a nurse, probably about a week ago, and coming in for a night shift. And I asked her how she was doing. She said, "We're good." I said, "No, how are you doing?" And she said, "I'm okay. I'm very tired." And she said, "But I know I've got 2 patients that I'm coming into. I'm not sure where they're going to be." And she said, "You know, when I work in the ICU, death is a part of working in the ICU. Unfortunately, it's critical care, but not like this." And I think that's the impact that we have to recognize of what this disease virus has done for patients. The technology has been phenomenal. I think the adoption of that was very key in being able to link our families, our staffs, to Margo's point, physicians going out in the parking lot, having conversations, our chaplaincy, our spiritual care, helping to meet the needs of some of those closures, keeping the visitation minimal, again, from a safety perspective was really key. But I'll go back to the one nurse I was talking to. We ended up having one of the parades around the hospital that day, and she said, "I know why I do this," and the appreciation. That's the morale that I think we can continue to keep intact with the partnerships and everything that's been done for the teams. That's how picking up a nurse at the end of the day who is exhausted, who has been through every emotional up and down, and being able to know the appreciation. Again, I go back to that appreciation and partnership from the community means and continues to mean so much for our teams of how do I pick myself up today? So it's that appreciation and that value. So again, thank you behind that.
Yeah, thank you for letting me go in a little off script this morning. But I think for those of us who haven't been through this on the front line, that's the part that we maybe don't see. And I think that's what's most important, back to kind of what Marilyn said about, you know, is it real, right? For you, it's very real every day, and how you're working with your teams to tackle it. And so I think that's important for the rest of us to know. You know, the question that comes up a lot is, what does the new normal look like? And I think what will be most interesting for businesses and residents to shift into is kind of what is the next step. And so I think, you know, I'll ask that of both our healthcare providers and also our elected officials, and Leah as well. I come from a family of teachers and healthcare providers primarily. And so I think what we need to be thinking about is not so much when. That's the question I hear raised a lot, but how. And I'm seeing some communities doing a great job of leaning into kind of an open and safe mode as we come into that, but that's going to involve education. So I want to pitch that out to anybody who'd like to answer it. But what does the new normal look like this and look like after this? And I think it's important for us all to realize that it's not going to be just returning to life as we knew it, right? And so I'll pitch that out for anyone who wants to answer that.
I'll jump in. This is Leah. So actually, what we're discussing is we're trying not even to use that term new normal. We're talking about new reality. Yep. Because it's not going to be quote unquote normal, whatever we perceive as normal. So what's our next reality, or what's our new reality? So we're having those conversations, and really right up front, we're talking about exactly what I think Margo or Marilyn was saying is everything that we're hearing. You know, a vaccine might be a year out. So not only does it need to be designed and developed, but then it also needs to be implemented and tested and make sure that it's effective, right? So we're just having that conversation right on the table. Look, these protocols that we're doing, we will probably have to do them for the next year, maybe 18 months, next year and a half. So let's just not fight it, and let's just accept that we'll be wearing a mask, we'll be social distancing for the next 18 months, maybe less. And if it is, great, maybe longer, but let's just wrap our brains around that. So once we put that on the table and just put it aside, then what is that like? And in a recent conversation, our chief technology officer was so brilliant, because we were sort of, we're all struggling wrapping our brains around these things, and oh, that's inconvenient, and oh, that's so frustrating, and oh, and he said, well, remember when 9/11 happened? Traveling after that was never the same again, and it still isn't. And sometimes it's still frustrating, the protocols we have to go through, and sometimes we still don't like it, because we remember when. And this is like that. And I thought that was a brilliant, I don't know if it's an exact comparison, but it was a brilliant example for us to kind of embody and say, yeah, you're right. So masking is, maybe frustrating. Social distancing is frustrating. However, what's the alternative? The alternative is exactly what Marilyn and Margo were describing. So again, we're just going to go with it and put that aside. And then once we've had those conversations and continue to remind ourselves of those principles, what's the opportunity here? What does that mean? So just like we were discussing, I'm so proud of AIMS employees. Literally in 1 week, they flipped, excuse me, all of their spring courses into a remote environment. They flipped all of their services, so student support services, to remote environment. Colleges and universities take years to do this. They literally did it in 10 days, which, again, amazing. Of what we have done and are doing, what's the benefit? What do we want to continue? What opportunity or new frontier, if you will, does this open up to us, and how do we want to engage that in our business plan for the future? And what does that mean? So now we're having also some exciting conversations about, oh, well, maybe we want to continue to do it this way, or, this was a Band-Aid, but how can we remove that Band-Aid and make it an institutional process or policy procedure? And that also gets us out of sometimes those spiral conversations of that can be pretty depressing and kind of down, right? So what's the opportunity, and how does that move forward? So what's our new reality, and we get to create it, and that's the upside. So that's my comment for now.
Yeah, thank you for your positivity. What's to be gained, right, in the ways we step forward? And I think that's important. It's important.
How do we leverage this and really use this to our advantage into long term to move us to the next phases?
Yeah. Any other comments? Anybody else?
Jamie, I'd like to say that I think this, in a positive way, has improved what our internet systems are. Our technology is growing in leaps and bounds, and quite frankly, it's been pushed because it has to. But I think we're still a ways away from having the perfect communication levels. But I can remember on Mother's Day, my mother-in-law talked with her son and grandson in Washington State, and she was in Wyoming, and she was just giddy over the whole thing because she was able to see them by Zoom, and they were able to do that with fairly easy technology. And just last week, I had a business owner that needed some help with the federal government, and I was shocked that they offered up a Zoom meeting, and we set it up, and the business owner and I and the federal government employee, there were two of them on the line, got together, we talked about things, and we have got the issue that the business owner was having pretty much taken care of. And so I think that part of it is also, as Leah said, the new normal or the new reality. And perhaps we can see some good things coming out of this. And I know that the internet providers are scrambling like crazy to get everything working as fast as they can. But I think it's going to be a good positive for everybody.
Yeah, thank you for that. It has caused some connectivity in other ways, right? So yeah, absolutely. Any other comments around any of that? Anyone would like to?
I would add, oh, I'm sorry, Mayor Gates.
Go right ahead, Margo.
I would say another lesson learned is the interdependency that we have on each other. And in hindsight, I wish I would have reached out to Mayor Gates, City Council, so sorry, earlier. And I think it's just good learning.
Yeah, absolutely.
I think that every situation that we confront as leaders is a lot easier to tackle if there's an end date. And this is perhaps the first dilemma that I've been involved in as an elected official, where there's not an end date, when you can expect things to wrap up. And that's making it a lot more difficult for all of us, I think, to as we make decisions for the future, not knowing how long you're making decisions for. I'm a pretty social guy. I probably detest working from home as much as anybody I know. I'd rather be out meeting people, doing this, doing that I'm really not able to do. I'm a handshaker. I often think to myself, gosh, I wonder if I'm ever going to be able to shake hands again. But what this has created, especially the longer it goes on, is a lot of impatience, anxiety, and anger. And no matter how much we all say, let's try to be kind to one another, many of us get that concept really well, but many do not. And I see things festering, not necessarily around Greeley, but on a national level. And I'm pretty active on social media. I haven't had a lot of time to camp out on it, but I had a friend about 2 weeks ago say, "Are you reading social media?" And I said, "Not really." And she said, "Well, don't." So I took it from that whatever decision the city council made during that period was unpopular. And while I'd like to get on and engage people and answer every question, regardless of their degree of anger, I would just say to them that they're not walking in our shoes right now. I think sometimes I think trying to run a pretty large city through all this is complex. But after hearing the two chief hospital administrators, our job isn't that complex at all. So it is true that working together is going to get us through this. And I understand there's a lot of anxiety and anger out there, but I think everybody on my grid, we are calm leaders. And I think that our constituents expect us to be calm. And I think we are being calm, and I think that'll get us through it. But a little less anger and anxiety would be nice. But I understand. I mean, I'm not suggesting I don't understand the anger and anxiety. There are plenty of people who can't pay their bills, who are out of work, who are in the process of losing their places, and I understand that. So we'll get through it. Feel good about our opportunities to get through it, but it's going to take some work. And then to my initial point, when? Nobody knows when.
Yeah, I think I'm going to wrap with that truly today. When you look at leaders, every day we're forced to look in a mirror, right? And take a deep introspective look at how we're engaging with the world and have perspective with other leaders about how they're tackling what they are. So this morning has been tremendous around our healthcare leaders. Thank you so much. Our education partners and our elected officials. I'm so proud to work with all of you. I'm going to wrap with a quote that I actually shared last week with Margo. And I'm going to insert he or she here because I think it speaks to everyone on this call. He or she was never quite ready, but they were brave, and the universe listens to brave. And I think the reality is we're all stepping into uncharted territory right now, and we're trying to be brave and we're trying to lead. And sometimes that's met with criticism, but it's also met with great steps forward. And I see Greeley going nowhere but forward together. And that's pretty wonderful considering everything that we've tackled in the last, what seems like a very long time, but only 5 weeks. So I'm so grateful to all the leaders on the phone for being brave and courageous in your leadership. Greeley is lucky to have you at the helm. I thank you for being on the show this morning. We will be broadcasting this at 9 o'clock on the Chamber's social media channels so that everyone can watch. On a really positive note, when we talk about making the shift into technology versus being face-to-face, I think with our first show, we reached 4,400 people who watched this all the way through. So that's pretty tremendous. There were some leadership lessons, some education, some pieces for them to understand about about what healthcare is tackling and what our elected officials are doing to lead. So what a tremendous platform for us to be able to share that message and for me to share it with you. So thank you for being on the show this morning. We'll look forward to visiting with many more of you in the days to come. And thank you for your leadership in this time and always. Take care.
Make it a great day.
Thank you.
Thank you.